When I get questions like, Ma, please, what drugs can I take? I'm having a hormonal imbalance. Or, Ma, please, I have not seen my period for a couple of months or for a long time. What can I take for me to start seeing my period? I have made series of videos about hormonal imbalance in women. Okay, now listen. Our body is controlled by different kinds of hormones. Our body is not controlled by just one kind of hormone. Let's take like the fertility hormone in women. We have the progesterone, we have the estrogen, we have the follicle stimulating hormone, we have the luteinizing hormone, and we have the prolactin. Now, these five hormones work hand in hand to enhance a woman's reproductive system. Now, if you stop seeing your period, because I think one of the signs of hormonal imbalance is not seeing your period, let's say for a couple of months. Irregular menstrual period, that is the word. So irregular menstrual period is basically one of the signs of hormonal imbalance. If that happens to you, you don't have to meet anybody to give you any drugs or injection. If you go to the pharmacy, they will give you drugs, they will give you medications. Say you want to see period, they will give you medications. They just want to sell their drugs. That is a very wrong step to take if you're having an hormonal imbalance. Go to the laboratory and run a test called hormonal profile or hormonal assay. I made a video explaining in details how this test should be done. Once these tests are done, all the hormones will be examined. Then you will now know the exact hormone that is imbalanced. Is it progesterone? Is it estrogen? Is it luteinizing hormone? Is it follicle stimulating hormone? Is it prolactin? You know the exact hormone that is imbalanced, because you see, sometimes each hormone depends on the other to function. So now let's say you're having issues with your progesterone. You now start taking medications for estrogen. You have even, in fact, you will succeed in making the hormonal imbalance worse. So the best thing to do is go to the hospital and do this test, or go to a good laboratory and ask for a test called hormonal profile or hormonal assay. Once you do this test, the results will be out. You will now know the exact hormone that is imbalanced. Then you show it to a doctor. Don't just go to any pharmacy and say, please look at my results, give me drugs. Show it to a doctor. They should see the results and then prescribe medications for you. Another thing I want to advise is, if you're having hormonal imbalance, after doing the hormonal assay, endeavor to do a pelvic scan. A pelvic scan is a scan that shows everything about a woman's fertility: your fallopian tube, your cervix, your ovaries, your everything. Now, there are other things that causes hormonal imbalance. You can have issues like PCOS, ovarian cyst, fibroid. Anything that is causing that hormonal imbalance will be revealed in your pelvic scan. So 2 things you need to do if you're having hormonal imbalance: you have to do hormonal profile and a pelvic scan. Infection is also a reason for hormonal imbalance. Infection can cause hormonal imbalance too. But these 2 tests are really, really important if you want to really tackle the cause and the treatment of that hormonal imbalance. If you want to do a hormonal imbalance test, there are procedures you need to follow. Let's say you see your period every month. Every month you see your period, but maybe the date is different. Now, your menstrual cycle, if it is less than 21 days, it is not normal. And if it is more than 35 days, it is also not normal. So if your menstrual cycle is less than 21 days, you are having an hormonal imbalance, despite the fact that you're seeing your period every month. If it is more than 35 days cycle, you're having hormonal imbalance, despite the fact that you see your period every month. So now let's say you see your period every month, but your menstrual cycle is not stable. You will go to the laboratory and ask the man to do a hormonal profile. Now, when you get there, make sure you go there on the 2nd day of your period. Let's say on the 2nd or the 3rd day of your period. It's very advisable for you to go there. Now, when you get to the laboratory, you're to run 4 kinds of hormones. You're to run the estrogen, the luteinizing hormone, the follicle stimulating hormone, and the prolactin. Those 4 hormones. When you get there on the 2nd or 3rd day of your period, though, demand for these 4 hormones to be examined. I mean, if you get there, the clinician will know what to do, because they will ask you if you see your period every month, so that they will know how to follow up. Now, they will get your blood sample and examine for those 4 hormones I just mentioned. But the full package comes with 5 hormones. The remaining 1 hormone, known as progesterone, they will count from the first day that you menstruated to the day 21 of your menstrual cycle. Then they will ask you to come back, and when you come back, you'll be examined. They will get your blood sample again, and they will examine for progesterone to check how your ovulation and everything goes there. Now, that's the full package for hormonal profile test. Now, if you don't see your period at all, let's say you don't see your period for a couple of months, like you don't see it at all, you just walk straight to the laboratory and do the whole 5 hormones at a go. This one, you don't need to return on day 21 again. You just do everything at a go. The progesterone, follicle stimulating hormone, luteinizing hormone, prolactin, and estrogen. The 5 of them will be examined in the laboratory, and you'll get your results depending on how many days the laboratory asks you to come back for your results. Like I mentioned earlier, once your result is ready, please go and see a doctor. Don't take that result to the pharmacy. Go and see a doctor so that it will be well explained and a good means of treatment will be administered to you.